Save Our NHS for inviting me to speak today on this We Own It National Day of Action. Not only were the government quite slow to implement a testing system for everyone, including NHS workers, meaning thousands of patients were moved from hospitals into care homes without ever being tested. They now want to scrap Public Health England, perhaps to make it Private Health England. We know that contracts have been given to their friends in high places in these companies, and we know that billions and millions of pounds are being spent on private healthcare at the moment. Thankfully, in the teaching hospitals in Sheffield, they were a lot quicker to provide tests to staff, nearly 10 days before it was recommended by central government. They used their in-house expertise to provide tests early to keep health workers on the front line before the spike in the pandemic. It is not enough that the government left it to individual hospitals. We need ministers to properly resource a national routine testing regime for all NHS workers that can keep their staff safe, keep patients safe and prevent the spread of the infection in healthcare settings, and keep health workers and support staff at work and get the NHS back on track. The reason I'm still talking about this is because the government has so far failed to do this. In fact, they voted against Labour's amendment to do just that. There is a stark difference between how hospitals in Sheffield approach the use of in-house expertise and the government's approach to testing and tracking. A complicated system has been created involving multiple private companies, and it is still unclear to me why Serco was given the track and trace contract. It has no expertise in this area, has already had to apologise for breaching data protection, and was previously fined £1 million for failure to deliver public service contracts, and now it's been revealed that they have been fined a further £2 million. Awarded a contract of £45.8 million, they are only achieving 53% of contracts on that programme. On care homes, we've seen outbreaks in 1 in 3, which is shocking. We found out earlier in the crisis that there was a cap on tests in care homes. We could see that managers may have been placed in a difficult position of choosing to test their staff or their patients and residents. Testing of patients discharged to care homes must not be forgotten, and we have seen failure on delivering regular testing to care homes over the holidays. A promise repeatedly pushed back as tests were deemed unfit. Going back to Serco, it is absolutely clear that they are not fit to deliver this service. Rather than private companies with little or no medical and testing experience, we should learn from the health professionals and public health experts who are working hard to respond to local public health emergencies. We've seen a failure in ensuring real-time testing data that is shared with public health directors, sometimes paused for days, even recently, a frustration that I know has been felt up and down the country as more and more local areas feel unsafe again. The government has been slow to act to get any kind of track and trace in place, and then this failing contract comes along. But we now need to put pressure on again to ensure that the future of any tracking system is informed by expert opinion, properly integrated with response teams on the ground and sensitive to the needs of our communities. We all know our communities better at a local level. We know the individual needs of our communities, and we should have a system that reflects that, but that requires cash coming down to a local level and powers for local authorities. I welcome the calls of We Own It and Sheffield Save Our NHS to remove Serco from this contract and not to renew this, and have more of a local approach. Let's never forget we want public health in this country, not private health. Thank you.